Welcome back, everybody. I'm super excited to be here today with Maegan Hodge. She's a local acupuncturist, traditional Chinese medicine expert. And so we're going to go into all things Chinese medicine, acupuncture, and some special things she does, which are super unique as well. So after I do an introduction, we'll kind of hop into things.
Okay.
Um, so today we're actually thrilled to have Maegan Hodge with us. She's a nationally board certified acupuncturist and the founder of Centered Richmond Acupuncture. She has over a decade of experience in traditional Chinese medicine. She's also dedicated to career to helping individuals find balance and healing through holistic practices. Her compassionate approach and personalized treatment plans have made her a trusted name in the Richmond community. Maegan's academic journey is impressive as her professional accomplishments. She began by earning her BA in psychology from the University of Virginia. She went on then to get her master's degree in acupuncture and oriental medicine from the National University of Natural Medicine in Portland, Oregon. She's completed over 3,000 hours of training during that time. And she also did her master's thesis exploring the correlation between ancient and modern understanding of anatomy and physiology, which actually might be kind of interesting to talk about in and of itself, how people thought about that stuff back then versus today. Today, we're just going to dive into all things acupuncture, traditional Chinese medicine, just to understand a little deeper about it and how it applies to our current standard of care, as well as in the functional integrative medicine world. It's something I use often with a lot of my patients, particularly with those with dysfunctioning with their neurological system and the regulatory system, their HPA axis, which we'll probably talk about a little bit.
Sure.
But first, Maegan, I want to kind of dive into how did you get into this? Because, this is obviously not, when you start studying, decades ago, this was not, on the radar of most, even probably myself as well.
Yeah.
Can you walk us through your personal professional development, where you're at today?
Sure. So as you said, my undergrad was at UVA. I studied psychology, and for a really long time, I thought I wanted to go into counseling or psychiatry, and I could just never. I kept I'd pull up the application, and I could just never really bring myself to apply. And it might sound strange, but I wanted something meatier. I didn't ultimately decided I didn't want to be a physician because I wanted to be able to do something other than prescribe medications. And I wanted to do something that was a little more getting into the weeds with people. And, I was like, I want to fix things for people. Like, does that exist? Can you actually heal people? Is that a thing? And I stumbled upon acupuncture and traditional Chinese medicine a bit by accident. A friend loaned me a book that was about traditional Chinese medicine dietary therapy, which sounds so nerdy, and truly it was. But I started absorbing this book like it were the most exciting novel I'd ever read. I was just plowing through this text that was like this big. I'd get home from work and was excited to read it. And that was sort of my introduction, and decided to go to grad school for this. And at the same time, I was seeing an acupuncturist who I was going through digestive problems, and I had these horrible allergies that would pop up a couple times a year, and they would get so bad that the whites of my eyes would swell. And this acupuncturist, I'm not even kidding, cured these allergies. They went away. I was almost 20 years ago. They never came back. And so I was, between the book and that, I was incredibly impressed and realized I'd found the thing that could kind of, work on fixing people, and was really excited about that.
Yeah. One thing you just said about, you read some stuff written from maybe 4,000, 4,500 years ago, referring to nutrition. Now, one of the things I think is interesting is that, ancient Ayurvedic as well as traditional Chinese medicine, they looked at gut health back then as being super critical. Could you just tell me a little bit about, how did they look at gut health as, the gut as far as the center of our body's mechanism, and what was their perspective on it?
There's many different schools of thought, and there's one sort of school that's called the spleen and stomach school. The spleen sort of gets misascribed to digestion in Chinese medicine. A better translation could perhaps be pancreas, though technically that's wrong, but just for our understanding. But when we talk about spleen and stomach in Chinese medicine, we're very much talking about digestion and related functions. So depending on what era of Chinese history you get, depending on what was going on with people's health at that time, you'll get different perspectives. But there's written record from a time that is more similar to current times, where people were doing very, very well. People had a lot of resources, a lot of money, and were eating a lot of very rich foods. And the digestive problems that developed in that era were very different than periods where there were pandemics or starvation. So I think what's unique about Chinese medicine is that it values looking at the environment that the person is in and the environment of the body, so to speak. Is this a problem of too much? Is this a problem of too little? What's if it's too much, what's going on? Is there stagnant blood in the area? Are there, phlegm and biofilms in the area? What might be impeding proper function? So there's lots of different ways of looking at it depending on the problem. Is the person malnourished? We see that less often these days. You might see it with young women who go to a lot of yoga classes and are eating salads every day, and maybe you're not getting good nourishment because they're accidentally eating too many raw vegetables. It's kind of hard on their digestion. They're having a lot of loose stool and thinking that's normal. But mostly with the patients that I see in our area of Richmond, Virginia, is we're all from the South. People love Southern food, and Southern food is very enriching of the body and tends to create these problems of excess, which in Western medicine, you see issues like high blood pressure, high cholesterol. So the gut problems from those two types of people I just listed are very different. And so basically, you learn to look at the type of person and think about the problem more globally, holistically, if that makes sense.
Makes sense, yeah. And one of the reasons I like working with you and sharing patients with you is because when our patients come back, I can talk to them. Like a lot of times I'll talk with other practitioners, they'll talk about my chi being stagnant, and I'm kind of like, what does that mean? But it's kind of, we talk in very similar language. But I think one thing that's really interesting is that the, gut health, the microbiome was considered woo-woo craziness in academic medicine 20 years ago. And it's just now in the last 1 to 2 years, literally taking fire. And now it's become the public consciousness that the gut microbiome or your gut health, we tend to focus on the microbiome, but again, it's just holistic from the mouth to the anus kind of thing.
Yeah.
Associated with, 75% of all neurotransmitters are made in your gut. You
Yeah.
have tons of nutrient factors made in your gut. And yet in traditional Chinese medicine and Ayurvedic medicine, they understood, maybe not, obviously not the way we understand, but they understood that gut health was super critical. Death begins in the bowels.
Yes.
We say that's, Hippocrates, but it actually predated Hippocrates.
Yes.
So can you tell us a little bit about some of their perspective as far as like foods, because there's the idea of warming foods and cooling foods.
Mhm.
Like help us understand in modern terms what they were observing,
Oh,
4,000 years ago.
so it's maybe important to back up and explain to your listeners that in Chinese medicine, things get broken up into these really simple categories. So I mentioned one, excess and deficiency. Another is hot and cold. Is the person a hot type body or they cold type body? And those categories extend to food and herbs too. So is this an herb that makes a person warmer or feel warm, or is this an herb that makes a person feel cold or can lower inflammation and reduce excess temperature? So food, let's see. And similar with fluid metabolism, they're always thinking about, does the food or herb warm somebody up, cool them down? And what does it do to the fluids in their body? And by extension, how does it make the body circulate? Whether we're talking about blood or lymph, and when you hear the term qi in Chinese medicine, sometimes that gets translated as energy. I've a translation that I like is the character of qi in Chinese medicine, and in Chinese language is basically steam coming off of a bowl of or a pot of rice. So one translation could take the implication of gases, and you can think about the movement of gasotransmitters in the body. And for people that don't know, gases play just a very crucial role, similar to neurotransmitters in terms of cell signaling in the body. So we're thinking about, how does the food move things around in the body? How does it impact fluid metabolism in the body? And how does it warm or cool the person? So like something I've been thinking about lately is people with sinus issues. Some people have these cold type sinus issues. Some people have more hot type sinus issues. Hot type would be where there's more visible inflammation or the sinuses feel swollen. Sometimes the person's face will feel actually hot. And so if you give a person herbs or foods that can exacerbate some of that inflammation, they'll get a lot worse. A person that has a more cold type will have like clear discharge as opposed to yellow with the hot type. And so the things that you give are very different for those two cases. If you have somebody who has less visible inflammation and they're more just kind of like drippy, clear fluids. Did that answer your question?
It does, yeah. But it actually makes me think about something. With a lot of my mold patients, one of the common things you run into is they have colonization of their sinuses. They'll have this thing called morcons. And they can also have yeast and other things that stick in their sinuses that release toxins that can affect the brain. I have several patients that are working on their sinuses for 1 to 2 years on biofilms. How would you, obviously you're in Richmond and we're a big moldy environment, so you see this as well. when you see someone who's had chronic sinus issues that you know has mold as a part of their illness, someone I've actually sent your way, like what, how do you think about these? Like, I think about biofilms, I think about, biotoxins. How from a traditional Chinese medicine, do you look at these patients, or what are some of the things you do for these people?
That's a great question. At first, my biggest concern and yours is to make sure that the exposure has been removed from their environment, because if they're constantly getting re-exposed, treating them is going to be very difficult. But, first you have to establish, from my perspective, the overall health of the patient. How well are they? What are the resources of their body? How much can you challenge them without getting really bad, side effects, essentially Herxheimer reactions or similar. And if a patient has otherwise been pretty healthy, they have good reserves, you can push things a little bit more. And with chronic infections like that, there's sort of a certain protocol that I follow where, from the Chinese medicine perspective, often what I'm doing first is working to remove damp and phlegm, which corresponds with the Western medicine category of biofilm. So I'm trying to give them herbs and help them employ strategies that are anti-biofilm, basically, so that their own immune system and circulation can get into these pockets where circulation has been limited, and so they can start draining and fighting these things off themselves. It's probably not really that different from what you're doing.
Well, it's really interesting. I think this is just more for people who are listening. Like in ILADS, which is the International Lyme Associated Disease Society, which I'm a part of, there's like two branches of that. And one branch actually uses a lot of herbals as biofilm busters, like Petunia, uses them actually with direct antimicrobial, but as well as anti-inflammatory properties. But one of the things I've found out, and some of the patients we've shared have been my really super crazy sensitive patients that I can't get antibiotics to, because they have these crazy Herx reactions I can't do binders with. Some of them actually been so sensitive that even like their environment EMF, and you've done some really interesting things with calming the nervous system down using electrical stimulation acupuncture, which I was super fascinated with. I've actually been reading a little bit about that recently. Can you talk about how when this nervous system gets like super crazy, and literally I'm like, some of my patients are so sensitive, they actually react with the cellulose and supplements, which is actually in the literature, particularly people that are hypermobile. And when you're like that inflamed, I'm kind of stuck. And sometimes, let's try something else.
Really
Like,
challenging.
explain in your world, how some of the acupuncture, electrical stimulation, even some of the detox stuff with herbs, really gentle things for these people that, on my end, antibiotics are too much, supplements are too much, even binders are too much.
Yeah. So for patients like that, sometimes if there's a specific type of gut impairment, often I can prescribe what I would consider to be food grade herbs that most people tolerate well, that are, kind of based on things a lot of us have in our diet to help the gut dysfunction. Often that helps. But what you're talking about, long COVID patients really put this into my mind. And the more that I am aware of this concept, the more that I see it with more patients with chronic infections, I think there's almost often some element of dysautonomia with patients. And acupuncture can be really incredibly beneficial in terms of helping rebalance the two sides of the sympathetic nervous system, the parasympathetic and the sympathetic. And why that is, remains yet to be discovered, but we see it when we give patients acupuncture. And, there's studies now where the acupuncture is lighting up certain parts of the brain pretty predictably. And so we know that the acupuncture is interfacing with the nervous system. We're kind of working on understanding how. But so I'll employ strategies. I'll use acupuncture, and I'll use often something called frequency-specific microcurrent. And I have certain programs that I'll run for people that seems to provide that type of balance and relief. And I just will talk patients through basic things like how to breathe in ways to support your nervous system health, and stuff that sounds really simple, so simple that it might not work, but types of things are often incredibly beneficial for patients.
Yeah, particularly when they're stuck, it's like you don't want to push them too much.
Yeah.
You mentioned, I want to come back to the dysautonomia thing real quick, because that's something I see all the time.
Yeah.
The frequency-specific microcurrents, I actually wasn't familiar with you doing those. Can you talk a little bit about those? Because that's something that I've actually been really intrigued with. And it's the idea of using really, really low biologic level energies, frequencies, to actually almost push your metabolism a little bit forward. Is that what you're doing with the acupuncture electrical stimulation? Is it a type of frequency specific,
So
or
I have
is that?
two types. I have basically what's are TENS units. There's a specific Japanese brand called Ito that acupuncturists love, where it just has little alligator clips you attach to the needles. And I will do that in two cases. For pain, it's incredible, obviously. And I'll do that even at these kind of low subsensory levels to essentially expand the benefits of specific acupuncture points. So, like, I had a prostatitis guy yesterday, and there's a couple of acupuncture points that even Western medicine doctors are using now, apparently on the ankle that hooks into the nerve pathway that goes all the way to the prostate. And so, you can clip things on like that when you want to juice up the visit, basically. What was your question again? Got a
It
little.
was it was like with the with the frequency specific microcurrents. What
uh
are some like ways in which you're using that? Because you were actually going down that pathway.
Oh, yes.
Because it's again, it's a frequency basically at a biological level. Like I
Mhm.
use PMF and some really higher, like
Yeah.
that are super crazy high, not but this is more like at the level of your bias frequency. So it's a very gentle
Yes.
energy that actually is pushing the physiology forward a little bit. And it's been around for I don't know, over half a century, actually.
Quite a long time. From the FDA perspective, you can only say that you are using it to treat pain. I will say anecdotally, I've noticed that it seems to help balance the nervous system for people, and it seems to help just encourage movement in general in the body. I've had some constipation cases that have responded really well to it. And it just seems to work well for people that are sensitive, and I'm using it to essentially complement what I'm already doing with the acupuncture treatment. I've used it with some fertility cases, interestingly. The thought being, if it's good for pain, it's probably working to increase circulation. So we know from Western medicine that to get pregnant, you need good blood flow to the ovaries and the uterus. So we've employed it there some too.
Yeah. Now, one thing I see a lot is dysautonomia. I feel like this is something that is totally unrecognized with people with chronic fatigue and fibro and long COVID and just general health issues. Even kids, it's straight. There's actually a clonidine prescription that's FDA approved to treat
Oh,
ADHD in kids. And it's kind of like that's treating the sympathetic overdrive in these kids. It's kind of intriguing. Um, I was actually really quite surprised, and I'm not sure how this communication happened with you a while ago, but the fact that and it's on your radar, I wasn't quite sure that that was something that's on the radar. I've
oh,
been
yeah.
nutritionized medicine. Could you like walk us through how you think about that? Because the way I think about it is much more like hardwiring, nervous system stuff. Obviously, the way you're looking at it, and you're treating patients with success from a totally different perspective. So could you kind of talk about how you view with that? Because it's something I see, like, depending on what you read, maybe 15 to 20% of the population has some degree of dysautonomia, which is a crazy statistic even to just ponder.
Yeah, I will say traditionally, in terms of what I'm aware of, there's not like a one-to-one category in traditional Chinese medicine that really corresponds with dysautonomia. What you see with a lot of diseases is you can, within a disease, there will be many different common diagnoses from a Chinese medicine perspective. So in Chinese medicine perspective, it's all pattern diagnosis. So, okay, this person has this disease, but how is their body presenting otherwise? So I'm always working to fit it into that framework. And there's not one specific thing where I see from a Chinese medicine perspective that's like always happening with dysautonomia. But it's a little weird that I ended up as an acupuncturist because my younger version of myself, I was very hardcore science, and I was like, I remember when I was graduating from UVA, I heard that one of my friends was thinking of going to acupuncture school, and I literally went, "What a weirdo! Who does that? What is this stuff? That's nonsense." So I'm kind of like often applying my science background stuff and my obvious interest in, the Western medicine side of things and saying like, okay, like I know this is going on here. So what can I use from Chinese medicine to sort of broach this newer diagnostic category essentially? And we know, like everybody knows that acupuncture is good for stress and balancing the nervous system. So it's kind of easy.
Well, it's really interesting how like some of the modern science in my world is going more to realize that brain-based inflammation by itself
Yeah.
can be a cause of chronic disease. And there's actually cytokine levels you can use. People that have elevated certain, interleukins like interleukin 1 and 6, actually you see that more common in depression. And so we're kind of actually realizing, I think maybe to the public consciousness, long COVID kind of brought this
Yeah.
in everybody else's consciousness, but in the functional medicine world, and we've known about this for decades.
Yeah.
Um, like neural inflammation is a big issue with, I feel, gut issues, the gut-brain axis, cardiovascular issues, wound issues. Like, so kind of segmenting to like, we're having an epidemic of anxiety, depression, mood disorders. Like, what are some of the things that you typically see and how do you kind of address those patients? Because in the conventional world, it's basically, you have an SSRI or dopamine deficiency and we augment that. In the functional medicine world, we do a lot of gut work and nutritional work, but obviously you're doing it from a different perspective, modulating the nervous system.
Is this a question about dysautonomia specifically, or are you just wondering what are some of the common conditions that I see in my practice?
Oh, this is more in relation related to mood disorders,
Oh, gotcha.
to like depression, anxiety.
Yeah.
Because we see those, because the way we put the symptoms together and give you a diagnosis of depression.
Yes.
But what's not depression? What if it's brain inflammation? What if it's
Right.
gut issues? And so like, it's almost like traditional Chinese medicine is more equipped to view at depression with sleep disturbances, depression with, like you said, pattern recognition.
Yes, absolutely. So in a sense, it's kind of a simple, it might sound like an overly simple answer, but usually with people with mood disorders, I see one of two things that are happening. And there's exceptions to this, but I would say this is 80 to 90% of people that happen to be coming to me. And the biggest one is gut dysfunction. So, like you said earlier, something like 75% of the body's serotonin or whatever is made in the gut, a huge amount. I forget the exact amount. And most of the people that come to me have gut dysfunction. And 80% of the time when we fix their gut dysfunction, their mood gets better. And any symptoms they might have had of neurological inflammation seem to calm down. And then, I'm trying to give them advice about how to eat better to sort of support the results that they've gotten with me. The second thing that I see is, not to use a Chinese medicine term that nobody will understand, but I'll explain it, is what we call liver qi stagnation, which basically just means that things aren't circulating very well in the body. And for most people, that means they're not moving enough. So most problems in modern life develop from these two things: gut dysfunction because of our kind of terrible diets, or, stagnation issues because we're not moving enough. And, it sounds overly simple, but there's Chinese medicine strategies that you can use for all the variations of those two cases. And that clears up or improves, I would significantly say, about 80 to 90% of cases that I see.
I think one of the things you keep on saying, I feel like in a lot of times I overcomplicate things because really the foundations of functional medicine, diet, exercise, sleep, meaningful relationships, it seems like an oversimplification, but there's so many. If 80% of chronic diseases in our country can directly be attributed to eating processed foods, but all of a sudden the biggest elephants in the room, so to speak, are these really kind of more basic things. I actually asked a question about how, I got written down, like, how does acupuncture work? And this is my understanding of part of how it works. Maybe you can kind of help me elucidate a little bit. And this is more, again, because I'm thinking more, my brain thinks differently than, your does. But it was really intriguing to me to find out that actually the acupuncture points in the body actually correlate with your body's electromagnetic fields actually entering, which is fascinating. Just like the earth has a electromagnetic flux, so does our human body. And the acupuncture points actually correlate, I believe, with low resistance parts on the skin. I think it's low versus high, correct? In my opinion.
Yeah, I believe so. Low resistance. Yes, that makes sense.
I think it was just fascinating that they figured out, 4,500 years ago that the body had an electromagnetic field, which now we're actually appreciating the heart does as well. And how the acupuncture is actually helping us with accessing that part of the nervous system through these low resistance spots and actually altering those fields, which ultimately we have research in the 60s from the VA with using electrical stimulation to regrow tails on frogs, for example. We have all this really cool stuff, but and we skip the idea of using the body's energetics to help heal. Well, is that roughly like your understanding, or how do you see like the body's flux energy as it relates to our body's energy that's being accessed or manipulated or affected by acupuncture itself?
That's a good question. And there's not one simple answer. And the reason that is the case is that these pathways that were mapped out with a fair degree of accuracy thousands of years ago are many things all at once. And that's one of my favorite things about Chinese language is each character, each symbol, each each word that you say can have multiple meanings at a time, and it's very intentional. There's many layers of meaning. I think that's a way in which Chinese culture is honestly very superior to Western culture, because there's this inherent understanding about how things can be many things at once. And in the West, we like to, things can only be one thing at a time. We have this like dualism that we struggle with. But anyways, so these pathways, when you look at the old terms for them, they're vessels. The pathways are vessels. And so that means they contain something. What do they contain? They tend to contain major pathways through the body of, major arteries, major nerves, lymph pathways. And because those things are moving through that area, there's a concentration of electromagnetic energy by extension, just as, we're electromagnetic beings. It's everywhere. So where stuff is moving through, where the highways are the most active is, where we're seeing that kind of stuff. And I think that, if you're somebody in modern times who meditates a lot, you can sort of dive into aspects of our senses that we don't explore very much. And that, I've been doing this a very long time, and I can feel a lot of things with my hands that, 20 years ago seemed impossible to me. So how that all developed is a little bit of a mysterious magic, but yeah, I'm rambling a little bit. Did that answer your question?
Okay, yeah, it did. I think the big thing is that we're actually on my end of the things learning how our body's electromagnetic energy affects our body's healing. We have centers. The heart is a center. Basically your parasympathetic nervous system, which is above and below your sympathetic nervous system, is a center. Your pineal gland is actually a center. And I'm more familiar with Ayurvedic medicine, how the doshas, how they kind of view those energy centers, which just happen to correspond with these ganglia or basically, which are places with lots of nerves conglomerating in your body, which you can actually pick up with. There's actually electromagnetic imaging that can actually pick these centers up. Does traditional Chinese medicine have a similar view of energy centers, or is it not? Again, I'm not as familiar with.
If you ask people in the West who've been trained in Chinese medicine, all the textbooks that came from like the 1950s China were translated that way, like qi as energy. But many intelligent people that I was at research and connections with scholars in China disagree with that translation, and it's seen more physically there than sometimes in the West we like to think about qi or energy. But the truth, in terms of physics, is that all those things are true. Chinese medicine is very oriented on these physical truths. There's some discussions of spirit in Chinese medicine. You can go on to, you can write whole books about that connects with mood and, the person's mental health, basically. But I forget which one of my professors said this, but, there's matter and there's energy, and not even talking in like a woo-woo sense at all. Both of those things exist. And when there's a severe physical problem, you'll get the best results when you're treating it from a physical perspective. If you have a sort of more minor physical result, it will be responsive to fluctuations in energy, and vice versa. If some things, this is less common, but if there's an energy problem, which could be interpreted, in terms of literal electromagnetic energy, or just things that are difficult to see, like mood, you can impact those things with physical treatment, but the more severe they are, the less physical treatment is going to impact those things. So that sort of delves into the realm of spiritual matters, which is absolutely outside of the scope of this conversation. Yeah. But I liked thinking about things that way.
So maybe so if someone has appendicitis, like a physical problem to get fixed, versus if someone's got IBS, which is, just a more like even in Western medicine, we're not quite sure what to do with IBS. Functional world, we have a lot of things with it, but is that kind of like that?
I would say more like appendicitis versus like like mild anxiety. Okay. Like mild anxiety will be often very responsive to more energetic treatments that are maybe interacting with the electromagnetic field or energy movement in the body. versus appendicitis, you don't want to mess around with trying to give somebody a frequency-specific microcurrent, like go to the ER.
Agreed. Yeah. Even though some newer research is actually showing, this is interesting, like treating appendicitis with oral antibiotics, if the patient's stable, you actually have better outcomes than surgical removing all of them, which is kind of
Makes
intriguing.
sense.
Yeah, it's kind of intriguing. So you mentioned detox a couple of times. Not in the functional medicine where we talk about detox a bunch. There's the kidney does detoxification using minerals and different kinds of things.
Yeah.
The GI tract with bile. Actually, lymphatics are dumping off toxins and chemicals in your small bowel as well. And a lot of my patients who are actually really quite sick, their detox pathways are blocked, and we'll try a binder to speed up part of that liver gut, and they works. Sometimes we'll do more moderate things like kidney detox, which is usually electrolytes and alkalization of urine and things like that. Could you touch a little bit, because some of my patients actually, some of my Lyme patients who've been really sensitive to things, you've done some like mild herbal things, which makes sense. It's helping the liver detox. They've had some pretty good results. So could you talk a little more about the way in traditional Chinese medicine, how do y'all do detox? Because we usually think, lungs, kidney, skin, spleen is like your body's biggest lymph nodes. That's kind of in between lymphatics and kind of gut. How do y'all look at detox pathways and address them?
I would say there's not really a one-to-one correlation with that train of thought. So it's a little hard for me to separate my Western knowledge from my Chinese medicine knowledge there and answer that question in a good way, because again, that concept kind of doesn't exist. But I will say what we now know are issues of congestion, from these detox pathways not working efficiently, do also show up in the liver, what's, considered the liver organ system in Chinese medicine, and the kidney organ system in Chinese medicine, and the stomach organ system in Chinese medicine, things that are related to digestion, liver, kidneys, and lungs too. So not a one-to-one correlation, but the problems show up in the same systems basically in Chinese medicine too, even though it wasn't maybe thought of exactly in that same way.
Yeah. Do you ever ask, this is just something I thought, do you ever ask patients about their stool consistency, or you ever get into?
Oh, yeah. People love that.
Well, my understanding of traditional Tibetan medicine, they actually make a big deal about urine,
Yes.
feces, breath smells, wet smell, which are all mainly detoxification, or like the byproducts of your own body's detoxification. Tell us a little bit about how you look at poop. I know how I look at poop.
Yeah.
People have symptoms.
So every acupuncturist or Chinese medicine practitioner that you talk to is going to give you different answers, because they're going to have different things that they resonate with. But you want to know how regularly somebody's going, of course. You want to know the consistency, loose or firm. I like to ask if they have to bear down to have a bowel movement. And I also want to know if they're having any discomfort, especially in their abdominal region, if it feels better before or after the bowel movement, or worse. If you feel worse after bowel movement, that tells me that something very different is going on than if you're feeling worse before you go and the discomfort is relieved by the bowel movement. And, I want to know, is the smell especially bad? I want to know if it is hot feeling when it comes out. All these things give me different indications about what might be going on. And if it is, the stool is loose, is there undigested food in it versus not? Those are just a few things that I can think of off the top of my head, but
And how do you
you'll
think?
see a lot.
Yeah. And so how do you look? Because I know how I think about, undigested food or the hot feeling. So if someone has undigested stool, loose bowels, and it has that kind of hot feeling coming out, what does that typically mean as far as their body's functioning?
Hot would be, so you would think of it as a more heat type based problem. So from a Western medicine perspective, more inflammation if there's a hot feeling. Undigested food specifically is usually that there is a weakness in the digestive tract. So the digestive tract is kind of too weak to be doing its job. So the person might not be producing enough stomach acid or pancreatic enzymes or something along those lines, or the tone of the digestive tract is really poor. So things are just running through.
Gotcha. Okay. Interesting weakness, because typically I think about low stomach acid, hyperchlorhydria, which is, I guess, is a weakness, or the things are moving through too quickly because there is inflammation or
Yeah,
bacteria, which again, you're not going to be digesting it. That's kind of
it can be both, but more traditionally from Chinese medicine, you think undigested food is a weakness. And there can be both things. There can be an irritation causing a weakness. So you have to assess for that. Same
so.
thing.
Yeah. So one thing we talked about initially when our conversation, like I was like, what are the things you'd like to talk about? And when I read articles, I read stuff from around the world. Unfortunately, I don't. I guess do you speak Chinese or read Chinese or?
I took a lot of classes in grad school, and that was a very long time ago. And now I can probably read about 3 words.
And because a lot of the stuff I'm reading is translated in English.
Yeah.
But there is a huge amount of literature on Chinese medicine. Could you talk a little bit to the evidence base in traditional Chinese medicine? Because in the West, we tend to think there's one kind of evidence, and we're actually I feel like we're at an inflection point, like in our culture and society right now. Because I feel like the idea of different kinds of evidence is kind of coming to our public consciousness. But traditionally, when people say evidence based, they mean randomized, double-blind, placebo-controlled trials, which is actually like less than 1% of all clinical research in the West. So when people say that, they're throwing out like 99% of all clinical research, those different kinds. But could you talk a little bit about the evidence behind?
Yeah,
So
I'd love to. So what I was saying to you before we started recording is that I hear this less as time goes by, but I went to grad school in 2006 and I started my practice in 2011. I would hear this more then than now, but people will just say, understandably, and again, because I was one of these people, oh, that's not evidence-based. I don't believe in that. There's not science behind it. And that's very wrong now on 2 counts. The first count being that there is 2,000 years of written record of Chinese medicine, and there's a huge number of books and a massive amount of text that amounts to 2,000 years of recorded observational data. And we believe that the system of medicine goes back at least another 2,000 years, perhaps further. They found some artifacts that maybe date it back to about 6,000, 4,000, 6,000 BCE. Might be messing that up, but a really long time. So thousands of years of observational data is a massive amount of observational data. And yes, it's in a different language. And yes, it's in cultural concepts that Western people aren't going to inherently understand very easily. But I think it's now that I'm older, I can say that it's foolish to dismiss that amount of observational data. It's massive. But also, additionally, there is an increasing, pretty sizable amount of what one might consider, more from a Western medicine perspective, more traditionally evidence-based information about all the different systems that acupuncture interacts with. We have seen acupuncture light up predictably certain areas in the brain. We have seen it under microscopes interact with the connective tissue and influence control centers in the connective tissue. I think that's the fibroblasts, if I'm not mistakenly remembering that term. 3 inches away from the needle in the connective tissue, 3 inches away, these control centers in the connective tissue start firing and tensing and relaxing. We've seen it interact with specific nerve fibers that are important on pain pathways. We've seen it influence colitis in the GI tract. There's an amazing episode on Radiolab called, do you know that radio show, Radiolab? I think you would love it if you've never heard it. This liver pathologist about 10 years ago discovered this new structure in the body. He called it the interstitium, similar to lymph flow. It's like this honeycomb-like structure that moves between all the cells in the body and contains 25% of the body's fluid. And this Chinese researcher found this research. He did some experiments on rabbits. He gave them colitis, very sad, but then gave them acupuncture. They got better. Some of them were cured, and he went looking in the interstitium to see if there was anything new and different that was happening after the rabbits had gotten acupuncture. And he found these cells called telecytes that were crazy activated after the acupuncture, that seemed to correspond with when the rabbits were improving from their colitis. And these telecytes are these really weird shaped cells that have these super long tendrils that people are still trying to understand, but seem to have some role in immune system function and cell signaling, essentially. So the whole picture is still forming, but it's clear to me from both perspectives that there's a massive amount of data. So if you're still saying, I don't believe in it, there's no science behind it, respectfully, you're just wrong.
Yeah. Well, I think it's really, when we talk about data, I have to remind people that when the pandemic started, we were saying there's no data for vitamin D and the immune system. And it was kind of like I had started checking levels of that back in 2002, based on my understanding of the literature. I was in my training at that point in time. And so 20 years later, it was controversial. Now we know, if your level's over 50, your chance of passing away from COVID was less than 0.001%. So it's actually almost determinative for in some populations of how well they do. And so the thing I tell people, if you wait for the science to catch up, so to speak, 50 years, give 50 years and 7,000 research articles before the Surgeon General of the United States said smoking causes cancer, right? Well, then it's really interesting. Well, it's interesting because I actually remember reading in China, it was like in the 1600s, they recognized the negative impact of tobacco exposure that had been introduced to the West to military to soldiers. So they actually start banning. Now it's part of the whole East-West thing with the English and stuff. But they realized this is bad because they delineate addictive behaviors. They delineate how it affected their health, and they were like, "This is bad. We don't." And again, in your culture where you need a strong standing military, anything that affects your military is bad. But it was interesting how they saw that a correlation half a millennium ago, and then we were struggling with it in the 70s here. So I feel like, one of the things in functional medicine, I have a Western mindset, but it's like a great example. Here we go. Like I remember reading about D. This is more Ayurvedic medicine being used with neurological conditions like Parkinson's, and I'm like, that's weird. Like that. Well,
he would have done.
But then you can start getting the gut microbiome and butyrate, and you realize actually there's actually a prescription drug that actually has butyrate in it, and Tutka that's being phenylbutyrate that's being actually FDA approved to treat the symptoms of ALS. And we've actually realized how important butyrate is, and nature's highest density thing that has butyrate is actually D. So somehow someone 4,500 years ago saw some correlation, and it just, that's what really intrigues me, like the ancient wisdom that we're now just getting assigned. Like I can understand now why ghee could be used, but when I first heard it, I'm like, that's hooey nonsense. There's so many things like that. I feel like that now more open to like, okay, like someone did this for 2,000 years, maybe there's something behind it. And then getting, what I would consider like evidence, quote unquote, like, published stuff behind, or even bench research, which in the traditional medicine world, we ignore bench research, which is like what textbooks are made of, right? So it's I think the evidence, we need to like have a bigger understanding of. It's not just randomized trials that are usually paid for by pharma. It's not just, or, NIH grant. It's epidemiologic data and historical data as well. People have been collecting the Ayurvedic and traditional Chinese medicine, Tibetan medicine information for, like, I didn't realize it was going back to 6,000. I didn't realize it went back to 6,000 BC. That's even longer than 4,500 years, right?
Yeah, a very long time. And that one's theoretical. They found some tools that were maybe for surgery, maybe for acupuncture, but the oldest acupuncture texts are basically describing surgery. So I don't think the delineation was that clear back then. It was just probably all medicine.
Yeah, well, it's also, you have to have, it takes a culture to be around for a while before people experiment with stuff, before you actually get something written down. So there's a history before that written. This is the prehistory, so to speak.
Yeah. Being on this journey has certainly been humbling for me, because I have constantly been faced with my own, biases and ignorance. And I kind of what I've come to after all of these years is that, people are like, well, why try something? It's very old if you don't know if it works or not. But, you and I both see a lot of patients who are in very bad shape and very desperate, and Western medicine has nothing for them. Long COVID patients are a great example. What's cool about Chinese medicine is that type of pathogen is very well known from a Chinese medicine perspective. And within a month of that hitting the ground in China, the TCM providers had herbal formulas that were working well for patients, because there's a written record of viruses presented in a very typical way. So if the treatment or the cure is going to be low harm and low risk, there's no, if you're somebody who has no other answers, why not try it? If nothing else is working for you.
And actually, that actually triggers something in my brain, because also during early on in the pandemic, they started using ursodiol over in China to treat long COVID, which it's a bile extract. I use a lot of Tutka in a lot of my patients with other issues. It actually helps your body detoxify better, strangely enough. Like, is bile, like ox bile or bile derivatives, is that something that's used at all? Like
Yeah.
can you tell us a little about, because I am actually super fascinated with bile because of its impact on the peroxisome, which is basically a detoxifying thing in your cells and actually improves mitochondrial function. It helps your body burn off dysfunctional lipids, where if you're familiar with all the seed oil stuff going on right now, like seed oils are these horrible toxic things. You can actually use TUDCA or UDCA and UDCA to burn those things off. From your perspective, from a TCM perspective, I'm kind of curious how they view bile. Because again, my perspective is totally going to be a different perspective than this one that has 4,500 years of knowledge behind it. What's your perspective on
So
bile?
I'll tell you that the textbook use for that is that it clears heat, so inflammation, dissolves phlegm, so can dissolve mucus, can dissolve biofilms, can help break down just kind of thick, goopy fluids. Calms wind, which can correlate with convulsions. That one, the modern correlation there is a little less clear. But, traditionally it's used for infantile convulsions, seizures, facial pluralis, tetanus, stroke, spasms, and cramps. And, you can obviously use it for any type of digestive issue. It's not a super commonly used herb. It's in some formulas, but mostly you'll give it with patients that have these thick, goopy, stuck fluids or biofilms.
Because it can also be helpful with gut biofilms as well.
Yeah.
So you obviously can look at TUDCA. So that's kind of interesting. So that's a great example of something that, I'm super excited, been researching a lot in the last couple of years. But, you just said a few basic, simple things. I'm like, oh yeah, seizures, neurological issue. Oh yeah, biofilms. So I feel like it's, marrying these two concepts together to help people who, it will be decades before we'll have quote unquote research trials to address. And,
Yeah.
and it's really interesting how I didn't realize within a month they were already treating it in China. It's kind of intriguing to me. I heard about in Indian hospitals, people when they're coming in, they were giving them turmeric teas and ginger tea, which lowers cytokines, have a massive and that's turmeric especially actually lowers inflammatory bacteria in the gut tract. So that the fact that they were already doing that and was in hospitals while we were still twiddling our fingers over here is kind of intriguing to me.
We handcuff ourselves a lot here. Oh, we don't want to do anything too crazy, like give them turmeric tea.
Yeah. What's funny, because like a medical dose of green tea for the EGCG to get some of its stem cell impact is like 46 cups a day. So if you're not in a culture that's part of drinking it, then you're not going to get 4 to 6 cups a day of green tea to get that quote unquote medicinal impact.
Yeah, fair enough. There's a resource you might like, and anybody listening might like. I use it. Pretty much every colleague that I know uses it for quick reference. It's americandragon.com.
Okay.
It was created by this acupuncturist who would consult with television shows. He passed away at the beginning of the pandemic, but he's quite famous in our realm. And you can look up the different herbs. And I just sort of read you the textbook, uses of that herb, and it came from that website.
Oh, that's cool.
Great resource.
Yeah, cool. Awesome.
Yeah.
So Maegan, any passing thoughts for my audience, as well as like, what are you doing if people wanted to know more about you, how would they learn about you as well?
Sure. So I'm at centeredrichmond.com. I have a social media account myself. I, post some health education videos a few times a week. You can find those links on my website. I mostly see patients who have digestive problems, allergies, hormone issues, chronic pain, and chronic infections. Those are probably my most commonly treated conditions at my clinic here. And I would say I specialize in more medical conditions, which I think is a little bit unique in the acupuncture community here. That's always been my interest and focus. And I would say just, keep an open mind, for your patients or anybody listening to this about your healing journey. Don't write off therapies that maybe aren't traditionally accepted, especially if you're not getting the help that you want from traditional Western medicine. There's lots of other options out there for you. You can see a functional medicine provider. There's an amazing one in Richmond. There's a couple that I can think of. You can go to an acupuncturist. You could, those are my favorite. I won't list other professions, but I just find that if people keep trying, they'll often find somebody that can help them. And obviously there's exceptions to that, but just don't give up. You deserve to feel good. You deserve to feel heard, and you deserve to work with a provider who takes you seriously and is working, from like, deep place in their heart to get you better.
Yeah, I think one thing, that drives me first and foremost, do no harm. And that's why I think people don't realize that, Tylenol and Advil cause a lot of deaths, cause a lot of kidney issues. And that's one
Yeah.
of the things, I think when you look at other modalities, what are the potential? I always look at what's the first downside. People don't realize the fifth most common cause of death in our country. This number has actually gone up. Is the iatrogenesis, which is things doctors do. It's medication complications, it's surgical complications. And so I always, before I start giving someone a recommendation, I'm like, okay, what's the downside? And that's where I think some of these, holistic alternative, whatever you want to call them, modalities, that have been, if something's really dangerous, you're not going to do it for 2,500 years to somebody, right? You tend to learn the nuances. One side question you actually triggered, do you work with alpha gal at all?
Oh, yeah, I do actually work with alpha-gal patients. I find that they're responding very well.
Yeah. It's really interesting. You probably know this, the literature more. There's actually a study published on acupuncture for alpha gal a couple of years ago. And I was like blown away. I'm like, oh my gosh, this is actually an actual published trial. Well, it
Yeah.
kills was like 20, 30 patients. But that's something that, again, acupuncture to help with alpha gal, like that's pretty amazing, I think.
Yeah, I read that study and used it in my approach. And that was just an acupuncture only based approach. And I will, with pretty much all those patients, combine it with traditional Chinese herbalism to just support their health in general. And I find that those two things together are working really, really well for patients. I have a patient who lives on a farm outside of town, and she got it and she was having horrible reactions. She had beef by accident one night, had basically anaphylaxis. And I treated her for like a month, maybe 6 weeks. She had another accidental exposure and nothing happened. And that's not every case that I see, but pretty much everybody has had a significant reduction in symptoms and has been able to get out of that anaphylactic reaction state.
And alpha gal, for those who don't know what that is, that's a tick bite induced
Mhm.
mammalian sugar actually allergy. I see a lot of people with exercise induced hives, anaphylaxis. Obviously, the worst cases, but a lot of people have these weird, they'll eat it and then exercise or do something or get stressed and have these anaphylactory reactions. They don't realize it's related to a tick bite
Yeah,
induced.
it's a weird one. It presents so many different ways with patients.
It does. It's so bizarre. And I've actually talked with Dr. Heyman, who's one of the big mold experts, because I've seen it a lot on my mold patients. Actually, a lot of my patients who have live in a moldy environment. So there's no quote unquote association in our world as to date with mold exposure and that. But I've noticed that curious association myself, and I'm looking for a link. So
Well, it makes sense to me that anybody that has any level of immunocompromised, that didn't come out right, would be more susceptible to these types of infections. So there may be a more specific one, but to me, it makes total sense. I agree that would be a thing.
cool. Well, Megan, thank you so much for your time. Really
Thank you
appreciate
so much for
it.
having me. It's really nice talking with you.
Take care. Talk to you
Take
soon.